Hello everyone, my name is Jenny Rios from the University of New England. This class is APN 775 and this is week 15. And today I'm going to talk about the association of obesity and sugar intake with non-alcoholic liver disease secondary of enhanced analysis. Nearly 2 in 5 US adults have obesity. An estimate of 38% of the adults in the United States have non-alcoholic fatty liver disease, with a 50% increase over the past 3 decades. Additionally, sugar consumption has been rising, where the average American adult and child consume approximately 68 grams per day, while the dietary guidelines for Americans recommend limiting the intake to 50 grams per day. The liver plays an important role in the body because it filters and processes the nutrients, including sugars, proteins, and fats. The liver stores glucose. However, when sugar intake is high, excess of sugar is converted onto fat through a process called novolipogenesis. This process makes the liver less efficient at removing or burning fat and can lead to inflammation, contributing to development of the non-alcoholic fatty liver disease. This condition often arises due to the sedentary lifestyle and an imbalanced diet. It can also affect glucose levels and is associated with high sugar intake, high blood pressure, and high cholesterol. The objective for this research include analyze the association between dietary sugar intake and non-alcoholic fatty liver disease prevalence among adults with overweight or obesity using an appropriate statistical test. The inclusion criteria for this project include participants have to have a BMI higher than 25, adults aged 18 to 60 years old, and it will also have to be diagnosed with a non-alcoholic fatty liver disease. The inclusion criteria for this research project must be followed to ensure accurate and reliable data. If the inclusion criteria are not applied, the validity of the enhanced data may be compromised, affecting the quality of the project. The exclusion criteria include pregnant women, participants who had been diagnosed with diabetes, cirrhosis, or fibrosis are excluded, and also participants who are who have a normal BMI or less than 25 are rejected. The methods for this secondary study use data from the National Health and Nutrition Examination Survey from 2017 to 2018. Data was analyzed using Stata software and imported as a XPT file. Variable BMI was used as a grouping variable, and the non-alcoholic fatty liver status, 0 as a no and 1 as a yes, was determined using CAP from the transient elastography data. The main independent variable was sucrose and fructose intake in grams per day from the DR1L sugar, categorized as a low as a 0 and high as a 1. Data sets were merged by sequence. The exclusion criteria, as I mentioned before, include pregnancy, diabetes, cirrhosis, or fibrosis. Survey design variables was SDMB PSU, SDMB STRA, and the BMI that I use the weight, which is WTMIC2 year, were applied. Descriptive statistics were included, and also another descriptive variable that I forgot to mention is the sex. So the results, the analysis show a significant association between high fructose and sucrose intake and the prevalence of non-alcoholic fatty liver disease. The odds ratio for the non-alcoholic fatty liver disease, it shows that an OR of 3.4, which OR of 1 indicates that exposure does not affect the odds for the outcome, and an OR higher than 1 indicates that exposure is associated with a higher odds of the outcome, and an OR less than 1 indicates that exposure is associated with a lower odds for the outcome. So the high intake of fructose and sucrose was significantly associated with the increased odds of the non-alcoholic fatty liver disease. And it also showed a p-value of less than 0.001. This research project found that among US adults with a BMI greater than 25, the high intake of sugar and especially sucrose and fructose is associated with the non-alcoholic fatty liver disease. So after having the results, we can conclude that having a high intake of sucrose and fructose was associated with adults with overweight or obesity having a higher prevalence of developing non-alcoholic fatty liver disease. Data from ENHANCE helped the research to determine if the study was statistically significant. Amounts of sugar, which include sucrose and fructose above the recommended daily intake, were higher in men than in women. This project was funded for the University of New England.